the more I think about, LPR, the more I feel like I have no idea what I'm doing with it. And, like if I'm treating it right, if I'm like, what's the latest, treatment algorithms? And let's just kind of like talk about like, what is it? And,
Sure.
how do these patients present?
Yeah. So as ENTs, I feel like we're all very familiar with the term LPR and silent reflux and how it can definitely cause a lot of throat symptoms. The way I describe it to patients is I essentially tell them LPR is basically a bunch of symptoms that have to do with your throat. So things like sore throat, globus, voice changes, mucus, throat clearing that we think are caused by reflux. And so we give them the term LPR. We know it can also contribute to ear issues as well as things like postnasal drip and chronic cough. So it's interesting because LPR, when kind of it was first coined in the 1990s, and then in early 2000, kind of a formal definition was given by the Academy, it really was just focused on issues of the larynx related to the effect of acid reflux. And that's kind of initially what the diagnosis was. We know now that it is so much more than that, but unfortunately, that understanding hasn't really transcended into kind of the general population of physicians or even ENTs. So the most recent definition that's kind of out there is actually from 2019, and it basically is a much more complex definition. And so it's the effect of both acidic and non-acidic reflux that's both direct and indirect on basically the entire upper aerodigestive tract. So much more complex definition of what LPR really is. And I think that problem with that is because it is such a complex definition and there are so many subtypes of LPR that we don't actually talk of it in that way. That's why the diagnostic plan. So I really think LPR should be defined into subsections, kind of similar to what our rhinologists have done for chronic rhinosinusitis. I think we as laryngologists definitely need to do that for LPR as well.